Think of calcium channel blockers as traffic controllers for your heart and blood vessels. These medications help relax and widen your blood vessels. This makes it easier for blood to flow, which is super important for keeping a healthy heart rhythm and controlling blood pressure. They're often prescribed to treat things like high blood pressure, chest pain, also known as angina, and certain heart rhythm disorders. It's really important for nurses to understand calcium channel blockers. You'll see them a lot in different healthcare settings. Knowing how they work, their effects, and potential risks is key to providing safe and effective patient care. To understand how calcium channel blockers work, we need to talk about calcium. Calcium is a crucial element in our bodies, playing a vital role in various physiological processes. Calcium is like a messenger for your cells. It helps transmit signals that are essential for many cellular functions. In the heart and blood vessels, calcium is responsible for muscle contraction. This means that calcium is directly involved in making your heart pump blood, and your blood vessels maintain their tone. When calcium enters the muscle cells of the heart, it causes the heart to beat with more force. This increased force is necessary for pumping blood efficiently throughout the body. When calcium enters the smooth muscle cells of blood vessels, it causes them to constrict, narrowing the blood vessels. This constriction helps regulate blood pressure and blood flow. This process is essential for a healthy cardiovascular system. Proper calcium regulation ensures that your heart and blood vessels function optimally. However, too much calcium can lead to problems like high blood pressure, chest pain, and irregular heartbeats. These conditions can strain the cardiovascular system and lead to serious health issues. This is where calcium channel blockers come in. These medications are designed to help manage the amount of calcium entering the cells. They help to regulate the flow of calcium in these cells, ensuring that the heart and blood vessels do not become overactive. By doing so, calcium channel blockers help maintain a healthy cardiovascular system and prevent complications. Imagine calcium channels as doorways on the surface of cells. These doorways allow calcium to enter the cells, triggering muscle contraction. Calcium channel blockers essentially block these doorways, limiting the amount of calcium that can enter. This blockage has two significant effects. First, it relaxes the muscles in the walls of blood vessels, causing them to widen, a process known as vasodilation. This widening lowers blood pressure, making it easier for the heart to pump blood. Second, in the heart, it slows down the electrical signals that control your heartbeat, helping to regulate heart rhythm. Not all calcium channel blockers are created equal. There are different types, each with a slightly different way of working. This leads to variations in their uses and potential side effects. Dihydropyridines are like sharpshooters, primarily focusing on blood vessels. They are very effective at relaxing the muscles in blood vessel walls, making them the go-to choice for treating high blood pressure. Examples of dihydropyridines include amlodipine, also known as Norvasc, nifedipine, marketed as Procardia, and felodipine, sold under the brand name Plendil. These medications are often preferred for their effectiveness in lowering blood pressure and their long duration of action. Section 5. Non-dihydropyridines, a dual approach to heart rate and blood pressure. This section delves into the unique properties and applications of non-dihydropyridines, a class of medications that offer a comprehensive approach to cardiovascular health. Unlike dihydropyridines, non-dihydropyridines are more like multitaskers. They have the ability to manage multiple aspects of cardiovascular function simultaneously, making them versatile tools in medical treatment. They work on both blood vessels and the heart. By targeting these two critical areas, non-dihydropyridines help to regulate blood pressure and maintain a steady heart rhythm. This dual action makes them useful for treating both high blood pressure and certain heart rhythm disorders, such as atrial fibrillation. Atrial fibrillation is a common condition where the heart beats irregularly, and non-dihydropyridines can help manage this effectively. Two common examples of non-dihydropyridines are verapamil, also known as Calon, and diltiazem, also known as Cardizem. These medications are widely used and have been proven effective in clinical settings. While effective, these medications require careful monitoring due to their potential effects on heart rate. Regular checkups and monitoring are essential to ensure the medications are working as intended without causing adverse effects. They can slow down the heart rate, which can be beneficial for some heart conditions, but may also lead to side effects in some patients. It's important for patients to be aware of these potential side effects and to communicate any concerns with their healthcare provider. This ensures that the treatment plan can be adjusted as needed for optimal health outcomes. Section 6. Therapeutic applications of calcium channel blockers. In this section, we will explore the various ways in which these medications are utilized in modern medicine. Calcium channel blockers are incredibly versatile medications. They come in various forms, including tablets, capsules, and even intravenous solutions, making them adaptable to different patient needs. Their ability to relax blood vessels and regulate heart rhythm makes them valuable in treating a variety of cardiovascular conditions. This dual action helps in managing both acute and chronic issues effectively. High blood pressure, or hypertension, is perhaps the most common reason for prescribing these medications. By relaxing the blood vessels, they allow blood to flow more easily, thereby lowering blood pressure. They effectively lower blood pressure, reducing the risk of heart attack, stroke, and other cardiovascular complications. This makes them a cornerstone in the management of long-term cardiovascular health. They are also used to treat angina, a type of chest pain caused by reduced blood flow to the heart. Angina can be a debilitating condition, and calcium channel blockers provide significant relief. By widening the coronary arteries, calcium channel blockers improve blood flow and relieve angina symptoms. This not only alleviates pain but also enhances the quality of life for patients. Furthermore, they are used to control certain heart rhythm disorders, such as atrial fibrillation and supraventricular tachycardia, helping to restore a normal heart rhythm. These conditions can be life-threatening if not managed properly, and calcium channel blockers play a crucial role in their treatment. In summary, the therapeutic applications of calcium channel blockers are extensive and varied. From managing high blood pressure and angina to controlling heart rhythm disorders, these medications are indispensable in cardiovascular care. Their versatility and effectiveness make them a vital tool in the medical arsenal. Section 7. Recognizing and managing side effects. While generally safe and effective, calcium channel blockers can cause side effects, just like any medication. Understanding these side effects is crucial for providing optimal patient care. Common side effects include headache, dizziness, flushing, and swelling in the legs and ankles. These side effects are usually mild and tend to disappear as the body adjusts to the medication. However, some side effects can be more severe and require medical attention. These include a slow heart rate, also known as bradycardia, worsening heart failure symptoms, and allergic reactions. Section 8. Contraindications. When calcium channel blockers are not advised. Calcium channel blockers are not suitable for everyone. Certain medical conditions can make their use unsafe and risky. For instance, they are generally avoided in people with very low blood pressure, certain types of heart block, which is a problem with the heart's electrical system, and severe heart failure. It's important to take a thorough medical history and assess the patient's overall health status before prescribing these medications. Section 9. Essential patient education for safe medication use. Empowering patients to take an active role in their health care is essential. Providing clear and concise information about their medications is a key part of this. Patients taking calcium channel blockers should be educated on the importance of taking their medication as prescribed, even if they feel well. They should avoid grapefruit juice, as it can interact with some of these medications and increase the risk of side effects. They should also be advised to monitor their blood pressure and heart rate regularly and report any unusual symptoms to their healthcare provider. Section 10. NCLX. Practice questions. Testing your knowledge. 1. A patient is prescribed amlodipine for hypertension. Which of the following side effects should the nurse include in patient education? A. Bradycardia. B. Cough. C. Dizziness. D. Shortness of breath. Answer. C. Dizziness. 2. Which type of calcium channel blocker primarily affects blood vessels and is commonly used to treat hypertension? A. Dihydropyridines. B. Non-dihydropyridines. C. Benzothiazepines. D. Phenothiazines. Answer. A. Dihydropyridines. 3. A patient with a history of heart failure is prescribed diltiazem. What is the nurse's priority assessment? A. Blood pressure. B. Respiratory rate. C. Heart rate. D. Temperature. Answer. C. Heart rate. Section 11. Conclusion. Key takeaways for nursing practice. Calcium channel blockers are important medications for managing various cardiovascular conditions effectively. As a nurse, understanding their mechanism of action, different types, therapeutic uses, potential side effects, contraindications, and patient education points is crucial for optimal care. By mastering this knowledge, nurses can provide safe and effective care to patients receiving these medications. Remember to always prioritize patient safety, advocate for your patient's well-being, and stay updated on the latest medical advancements and research.